Good afternoon, everyone, and thank you for joining us today. To start with today, I'd just like to hand over to Ebony Lewis, who will give us an update on Aboriginal and Torres Strait Islander health. Thanks, Ebony.
Good afternoon, everyone, and thanks, Anna. I'd like to acknowledge the traditional custodians of the many lands on which we are meeting on. I'm coming to you from Bidjigal country in Sydney and pay my respects to all elders, past, present and emerging, and any Aboriginal and Torres Strait Islander people online here today. So my name is Ebony Lewis. I'm an Associate Lecturer and co-lead of the Aboriginal and Torres Strait Islander research team at the School of Population Health at the University of New South Wales. This advice has come from the Aboriginal and Torres Strait Islander OzSAGE working group. As the COVID-19 pandemic continues in Australia, the working group recommends that over 90% of Aboriginal and Torres Strait Islander people aged 12 and over are vaccinated, preferably over 95% before relaxation of restrictions and borders opening up. Aboriginal health leaders and organisations have also called for high vaccination coverage of 95% or more for Aboriginal and Torres Strait Islander populations. So, for example, the Aboriginal Medical Service Alliance, Northern Territory, the Australian Indigenous Doctors Association, and the National Aboriginal Community Control Health Organisation. And we, the Aboriginal and Torres Strait Islander OzSAGE working group, supports this, as we need to make sure that no one is left behind in the COVID-19 pandemic in Australia. So there have been more than 5,500 COVID-19 cases among Aboriginal and Torres Strait Islander peoples. As of the 20th of October, New South Wales had 156 cases, and in the recent Delta outbreak, Victoria has had 297, and the ACT has 155. Around 600 people have been hospitalised, with 65 admitted to the intensive care unit and more than 10 deaths. Currently, 59% of Aboriginal and Torres Strait Islander people over the age of 12 years have received at least one COVID-19 vaccine dose. 45% are fully vaccinated. Now, importantly, in the ACT, over 80% of Aboriginal and Torres Strait Islander people 12 years and over have received at least one dose, and in New South Wales and Victoria are expected to pass 80% today. However, importantly, vaccine data reports around 20% lower rates of vaccine coverage in Aboriginal and Torres Strait Islander people compared to the wider population. Now, in other states and territories, vaccine uptake continues to be lower, particularly in some remote areas which have reported extremely low vaccine coverage. This is a gap we need to be mindful of as vaccination rates remain lower for Aboriginal and Torres Strait Islander people across Australia. Aboriginal people have been identified as a priority population since the start of the vaccine rollout, and all people 12 years and over are now eligible for vaccination. So with easing of restrictions, Aboriginal and Torres Strait Islander people must not be left behind. So COVID-19 is a disease of the unvaccinated, and with lower vaccination coverage, this can have devastating impacts if COVID spreads through communities, particularly those in remote areas with very low vaccination coverage. So we've seen, for example, recently in far western New South Wales, Kenya. So the pandemic has put a spotlight on inequities, both here in Australia and across the world. Aboriginal and Torres Strait Islander people are living with more chronic health conditions and earlier onset of these conditions. So these conditions, for example, can be things such as diabetes, renal disease and cancers, and this increases a person's risk of getting severely ill if they do get COVID. Now, expert analysis of younger Aboriginal and Torres Strait Islander people, so that is those aged 40 to 59 years, suggests the proportion of deaths in that age group is about 3 times higher than that of the non-Aboriginal population. Higher vaccination coverage will help better protect those with chronic conditions, those who are more susceptible to severe illness, and will also help better protect the unvaccinated. The Aboriginal and Torres Strait Islander population has a relatively younger age structure than the wider population, and a greater proportion are living with chronic conditions that can increase severity of illness. Now, in those aged under 12 years, the rate of infection is almost double that of the non-Aboriginal population. So higher vaccination coverage will also help better protect those who are not yet eligible for vaccination. access to appropriate health services, as well as available and affordable measures such as PPE to protect oneself from COVID-19 is needed, and particularly in these areas outside of the big cities where there are known health service gaps and workforce staff shortages. So high vaccination rates are certainly achievable, and we have the capacity as a nation to do this, but further efforts will be needed to support the vaccination of Aboriginal and Torres Strait Islander people. We need to ensure no one is left behind in the COVID-19 pandemic here in Australia. So the working group continues to recommend over 90% and preferably 95% of Aboriginal and Torres Strait Islander people aged 12 and over are vaccinated to better protect communities and prevent outbreaks prior to states and territories opening up. That all levels of governments listen and continue to work with community leaders, Aboriginal organisations, and those on the ground to ensure Aboriginal and Torres Strait Islander people have all the things they need to protect themselves and others in their home and in their community. Addressing health service gaps, particularly in areas outside of the big cities, addressing workforce staff shortages, particularly where services are already stretched, and that disaggregated data is made available on vaccine rates. That is data that is broken down by population groups and regions, as this data is important as it lets us know who needs what, where and when. So as New South Wales moves towards relaxing restrictions and other states and territories, remember that still many people in the population are not vaccinated, and an even higher proportion of Aboriginal and Torres Strait Islander people remain unvaccinated. So it is a responsibility of governments and individuals to support and protect priority populations, such as the Aboriginal population, to ensure equity and that no one is left behind. And lastly, I'd also just like to mention that other members from the working group have released an article today in The Conversation just a couple of hours ago. And this is with discussion on vaccination in Aboriginal and Torres Strait Islander peoples. And the link will also be made available on the OzSAGE website for everyone to have a look at. Thank you.
Thank you, Ebony. I also wish to acknowledge and pay my respects to the traditional owners of the lands on which we're all joining from today, and their elders past, present, and to those yet to come. My name's Anna Davidson. I'm coming to you from Biripi country. I'm an OzSAGE member and director of the Port Stephens GP Super Clinic. And I've worked in regional primary care for over 12 years. Today, you're going to hear the latest OzSAGE advice for regional and remote Australia, including the impact of eased travel restrictions between metropolitan areas and the regions. There'll be an update on statistics and deaths in the home as well. There'll be time for questions at the end, so please raise your hand or place a question in the Zoom chat and we'll answer those in order. If you have any further media inquiries after today, you can direct those to Amy Stevenson and we can put those details up. Today's conference will be recorded and made available on the OzSAGE website at ozsage.org. So who's speaking today? I'm going to hand over to Dr. Karina Powers. She's going to cover the weekly COVID statistics and deaths at home, and then to Associate Professor Craig Underhill, who will present the OzSAGE advice for rural and remote Australia. So Karina, can I ask you to give the update on the weekly COVID statistics and death in the home? Thank you.
Thank you. I'm coming to you from Noongar land today. Can I please have my screen shared? There have been over 15,481 community cases of SARS-CoV-2 infection. Since you can see the graph at the bottom with the blue and orange and green bars between 18th of October and 24th of October. And these numbers are above 2,000 each of those days, excepting the 24th of October, where it was 1,764. 50.1% of all cases are below 30 years of age, and you can see that in the top graph with the light blue lines. 73.1% over 16 are fully vaccinated. This leaves a significant proportion of the whole population not vaccinated. Next slide, thank you. There have been 63 active outbreaks in aged care facilities across Australia. 134 new resident cases, 26 new staff cases, 15 new deaths. There have been significant numbers of school outbreaks. 31.87% of cases are below 20 years of age. In Victoria, between 4th of October to the 22nd of October, there were 234 public school closures, more than 20 private school closures. And in New South Wales, between 4th of October and 22nd of October, there were 67 closures, 48 were public and 19 private. Next slide, please. And we can see the doubling time has continued to improve in New South Wales, but this could begin to decline soon. And Victoria and ACT have continued to see an increase in growth as compared to last month. Next slide, please. There have been 113 deaths reported in this past week. Sadly, one death at home in New South Wales, a man in his 50s, and we're aware of another death in a young person who was under age 30. We recommend that deaths at home be reported for all jurisdictions. The reason for this being it's a alert to the fact that something may well be failing in the health system. For instance, people unable to ring for an ambulance times being blown out, or problems with hospital at home and access, and these numbers of deaths at home are extremely important for every locality to be reported. Thank you. Next speaker.
Thanks, Karina. I'm going to ask Associate Professor Craig Underhill to present the paper that we're here for today on rural, remote and regional Australia. Craig, are you there?
Yes, I am, Anna.
Thank you.
So I'd also like to pay my respects to the Aboriginal people of the lands on which we meet, and extend my respects to any Aboriginal or Torres Strait Islander people who may be on the call today. I'm coming to you from Wiradjuri country. You can see the colonial states of New South Wales and Victoria over my left and right shoulder, respectively. It's Lake Hume in the background. So this is a really important topic today. Why do we feel passionate about the need to protect regional, rural and remote communities during the pandemic? Well, we know that health outcomes in general are poorer in those jurisdictions. We have significantly less health services than some metropolitan areas. We rely on constantly sending complex patients to metropolitan services for subspecialty services. Many towns are staffed by GP on call, or may have small hospitals that are staffed by nursing staff on call, may not have a GP. And so the prospect of outbreaks in those areas is a real concern to many of us. We rely on a functioning transport system that can transfer patients from smaller centres to larger centres, especially in terms of emergency care. And so we need to ensure that we can minimise impact on that system as well. So we have some particular concerns about the opening up of some of the larger states at the current vaccination levels of the regional areas. So in general, the regional areas lag behind the metropolitan areas in terms of access to vaccines. Pleasingly, in some of the larger regional towns and cities, there has been good double dose coverage, but these are recent vaccinations in many cases, as the supply has only just recently come on board in many areas. And it's quite a heterogeneous pattern if you drill down to some of the specifics. There's generally the more remote or the more underprivileged, the lower the vaccination rates. So pleasingly, the New South Wales government has restricted the movement of people out of Sydney until the regions are at 80% double dosed. But we'll see this Friday night in Victoria, on the day in which we're expected that the state as a whole will get to 80% double dose. People in Melbourne will be able to move out into the regional areas and coastal towns that may not have the same coverage as the metropolitan populations. And certainly those areas have a lower health capacity if there is outbreaks, that many of the health services in regional and remote areas don't have the same testing capacity, don't have the same primary care or hospital capacity to deal with an outbreak, or to deal with water sport accidents, car accidents, or other illness if the system is already under strain because of COVID. So we see that vaccination is an important measure to help prevent outbreaks and to minimise the seriousness of COVID-19 illness and hospitalisation, ICU admissions. So we urge that special consideration is given to regional areas to ensure that no one's left behind, that all areas have adequate coverage before they're opened up. So the peak national Indigenous organisation, NACCHO, has made that call that they are asking for 90 to 95% coverage of the Aboriginal and Torres Strait Islander populations and communities before opening up. And similarly, the Rural Doctors Association has made a call that we should open up LGA by LGA and only allow visitors into the LGA once an adequate vaccination level is reached. We need to make special provision as well to ensure that regional, rural and remote health services are given extra resources to cope with any outbreaks in terms of extra health resources as required. We know that the COVID-19 pandemic has highlighted disparity and inequity. And my fear as a regional practitioner is that the coming surge in cases throughout regional Australia will highlight exactly that, the disparity that we have in the health systems in Australia, and the lower capacity will be unfortunately borne out, and that there may be serious consequences for the regional and rural populations of Australia unless we can pay them due consideration, ensure the vaccination rates are adequate, and ensure that their health systems are aided to cope with any outbreaks.
Thanks, Craig. So we're going to open up for some questions now if anyone would like to. I have a question from Helen Ballard to Craig. So Helen, would you like to ask Craig your question?
Hi, Helen, I think you're on mute.
I beg your pardon. Thank you.
All
Craig,
right.
you mentioned that you were fearful for regional areas about their resourcing. Albury has a 10-bed COVID hospital being established at the top of the cancer centre. Is that enough for Albury to cope, given that it has to provide for the whole region?
Helen, that's a really difficult question to answer. It's a great question. We're just really not sure because we're not getting regional modelling. So the modelling, with the Doherty report from the Doherty Institute or the Burnett Institute looks at statewide data. And so we don't have that drilled down regional modelling. So simple answer is, look, I don't know. I don't know if anyone's done that modelling as yet. We hope that the vaccination levels will mean that there's less people hospitalised, less people in ICU than we've seen up to this point in some of the larger outbreaks in Sydney and Melbourne. But is a 10-bed COVID ward enough? We're really not sure. At the moment, we're streaming patients. So we transfer patients from Albury-Wodonga, go to other hospitals in Melbourne or in Shepparton, which has a COVID ward. But, we're concerned about as we open up and there's an increase in cases across Australia, that we'll be able to continue that streaming process.
Thank you. I just had one other question, if I may. Craig, in the initial recommendations from OzSAGE that I had a quick look at before jumping on this call, it was mentioned that there are fears about inadequate ventilation in offices around New South Wales. I'm wondering if you share those concerns and whether you could predict whether many offices around Albury are inadequately ventilated to accommodate a full opening of regional New South Wales.
Again, Helen, I might defer to others but on the panel, but I don't know the answer to specifically in Albury, and it may be timely for your organisation and others to do an audit of the air quality. And on OzSAGE's website, there's some fantastic resources on the concept of ventilation plus, so ensuring that indoor air is of high quality. And there's some tools and resources there that you can utilise to audit your space and measures you can take if it's inadequate.
Thank you. Thanks.
Catherine, you have a question?
Yes. Hi, Craig. I just wanted to clarify. So is OzSAGE themselves saying that regions should only be opening up LGA by LGA based on the vaccination rates? And what is the vaccination rate that regional areas should be hitting to be able to open up?
It's a great question, Catherine. Yes, that's what the regional rural and remote working group of OzSAGE has recommended, that we do open up LGA by LGA. The 80% vaccination rate, double dosing for 16+-year-olds is probably not adequate to prevent significant spread within the regional population, given the lower capacity of the health system. So what we're saying is that those rates may need to be higher in the regions in order to afford adequate protection and not to cause adverse outcomes in the setting of this reduced health capacity that we know exists throughout regional Australia.
Okay, and that rate, but you don't know exactly what that rate would be, or is that 90 to 95% rate?
The 90 to 95% rate has been recommended by NACCHO, the Peak Indigenous Health Organisation, and I don't think we have landed on a specific number, but we're calling that the 80% for 16-year-old plus is probably inadequate to deal with a significant outbreak in a regional area.
Yeah, okay. And have you had any indication from government that they would be receptive to an idea like this?
Well, the New South Wales government did respond to a call out by the Northern New South Wales cross-party group of MPs that wrote to the Premier and the Health Minister several weeks ago, and in response, they are not allowing people to leave Sydney until there's 80% double dose vaccination rate in the regional areas. So the New South Wales government has responded. We haven't seen that as yet from other jurisdictions, but and you know, Victoria's charging ahead this Friday night, so it may be too late for Victoria, but we're certainly seeking that other states and territories do consider this as an issue in their roadmaps to opening up.
Great, thank you.
I might just ask Dr. Karina Powers if she can talk about the business question just earlier. She might give a bit more detail on that. That might be helpful.
Yes, so I'm an occupational environmental physician, so I'm incredibly interested in what happens in workplaces. And we recently released a document called Creating Safe Workplaces During the COVID-19 Pandemic, which includes advice and links to advice on ventilation, but in opening up to reduce numbers of people becoming unwell, and also for the people who cannot be vaccinated, it's incredibly important that businesses do everything they can to put in layers of controls. The same as for remote, regional and rural health systems. Wherever possible, the more controls that are able to be practically put in place will spare numbers increasing in the health system, which is already strained in many areas. So the document's called Creating Safe Workplaces During the COVID-19 Pandemic. It's on OzSAGE.org, and it will be put up again under advice documents very shortly. Currently, it's linked under a media release notification that has Professor Duckett's name in it. Thanks.
Thanks, Karina. Do we have any other questions for anyone today? No? Craig, did you have any final? Oh, Helen, did you want to ask?
Yes, sorry. Could I just ask one more question of Craig, just to clarify? And I'm sorry to be so parochial, but we're regional news service. Craig, do you believe that Albury is adequately resourced for the reopening of New South Wales, which is imminent? From a medical resource point of view, do you believe that we're ready?
Helen, the latest vaccinations rates I saw was from a week ago, and we certainly at that point, we were not adequately vaccinated. That vaccination rate is increasing rapidly. So when I think is it November 1 when New South Wales is released. So I'm not sure, we'd have to do some projections about that. There has been, and again, our expected number of hospitalisations, ICU admissions, it's hard to say, but I think we're certainly likely that we're going to need more assistance from both New South Wales and Victoria to cope with the significant outbreak that's occurring now and the likelihood of a much more higher number of prevalent cases in the community. When, you know, it's fair to say that like any regional health service, we're quite fragile in that we've seen the impacts of furloughing staff. You know, if we don't have a hospital down the road that we can just say, can you come and help us today? You know, the help's several hours away. So that's where I think, that's why we're calling for extra measures to ensure that we can cope if we run into trouble. All of the regional services are at a lower capacity, and you don't need to take much out to really have quite a significant impact.
Thanks, Craig.
Thanks for that, Craig. Anyone else have any questions about the document or about regional, rural or remote questions for today? No? Then I think, thank you everyone for coming today. I hope that you read this paper and really think about regions, rural and remote, that the health systems there are fragile, they're interconnected with transport services, and the capacity to take on additional patients from a COVID outbreak and the impact on non-COVID patients is really huge. So thank you for coming today and listening to us. And yeah, I look forward to seeing your reporting. Thank you.